thanks for joining me. Today I'm going to be talking about robotic surgery and also a surgical position called Trendelenburg. I am not a doctor and I'm not sure if I'm pronouncing Trendelenburg correctly because I've also heard it pronounced as Trendelenburg and also a pronunciation in German. But this is the correct spelling of it, Trendelenburg. And it has to do with the incline of the table that the patient is placed upon. And in the Trendelenburg position, the head would be lower than the feet. In reverse Trendelenburg, the head would be higher than the feet, and the angles can vary. Now, this position might be used in non-robotic surgeries as well as robotic surgeries. And I first heard about this when I was in Connecticut, and I read an article about some patients who had been put in rather steep Trendelenburg positions for quite a long period of time. And many of these patients had pre-existing conditions and or glaucoma, and when they awoke from surgery they were actually blind because this steep position can put increased ocular pressure and so forth. So some were temporarily blinded and some permanently. So if you're going to be getting surgery, ask your surgeon if you will be put into this position, and if so, what risk, if any, they might pose for you. Also ask if they take any precautions to minimize those risks. Now, as far as robotic surgery in general, there are some benefits to it, but there's risk as well. And some of the benefits are it can really allow for superior dexterity and more precise surgery because the robotic hands can get into a little more nook and cranny areas that a surgeon's hands might not have been able to. And it can also give an enhanced visual view for the surgeon. So there are some pluses to this, and if things go well, it's been said that you have less risk of infection, less blood loss, less hospital stay, less pain. But some of the risk, I've heard that, especially at these really steep angles of patients actually sliding off the table, which obviously could result in injury. And sometimes they have to use braces and pads and so forth, and they may worry about injury from workable devices or neurological injury and some blood clots as well. And there's also can be a stress on the respiratory and cardiovascular system. And I've also heard that for those who are obese, this can also pose some additional risk as well. So if you're going to be getting robotic surgery, make sure you understand the risk involved and talk to your doctor more. Also ask your doctor about how many hours or how many surgeries they have put into robotic surgery. Have they been trained well? Because there was talk many years ago about surgeons who only had a few hours worth of training, and I believe things have improved, but you really want to feel comfortable going into this and have trust in your surgeon. So ask how many robotic surgeries have they done like this, and how many using that specific type of robot that hospital or surgical center you'll be going to has. Also ask for those patients who had surgery similar to yours. What was their outcome? Was it positive? Did they run into problems? And not all hospitals offer robotic surgery. The robots are really expensive. My understanding is they can be $1.5 to $2 million, and that could be different now. And it's quite expensive, so not all have them, and hospitals can differ in the types that they have. Da Vinci was a popular one, but there's others as well. So you really want to talk with your doctor and make sure you understand what you're getting into. And if you are offered robotic surgery, you could ask your doctor, could this surgery be done in a non-robotic way if you're more comfortable with that? Is there a surgeon who would do it without the use of a robot? I was once going to be getting surgery. It was right around the time that article came out that I was talking about that I saw in Connecticut. So I brought that article to my surgeon and I said, are you going to place me in this Trendelenburg position? And to my surprise, he said yes. and he thought I could perhaps be there for quite an extended time. So I opted to go to another surgeon who did not utilize that particular position, and he felt it was a bit risky for my situation overall. So think about that too. And again, there can be benefits to robotic, but you really want to make sure you understand it all. So I'm just looking at my notes to make sure I haven't forgotten anything. That's about it for today, but I really appreciate you watching and listening to these videos. I'm trying to spread awareness of things that are not often talked about. So I deeply appreciate it, and I hope to see you next Friday. Please join me then. Bye.